Hello, this is Dr. Nicole Davis, and I'm with my lovely wife, Carolyn Rosenblatt. And we're going to talk to you a little bit about some of the ways that the Affordable Care Act benefits seniors, and one thing that it doesn't do. And this is critical information that you need to know. And if you are a financial advisor, this is something that's equally important for you to be able to understand so that you can communicate this to your clients. And it has a lot to do with doing future planning that will affect them as they grow older. So here we go. Thanks for joining, and here's Carolyn.
Hello, this is Carolyn Rosenblatt. Welcome to the webinar. We're from aginginvestor.com and agingparents.com, and we'll be discussing 5 big ways the Affordable Care Act benefits seniors, and one thing it doesn't do. The Affordable Care Act saves lives. The preventive services and annual wellness visit are now mandatory in all Medicare plans. Many lower-income seniors couldn't otherwise afford preventive screening. Preventive care saves lives. Medicare beneficiaries are eligible to receive many preventive services that didn't exist before under Medicare with no out-of-pocket costs now. These include flu shots, tobacco cessation counseling, as well as no-cost screenings for cancer, diabetes, and other chronic diseases. Seniors can also get an annual wellness visit so they can talk to their doctor about any health concerns. Because of the Affordable Care Act, over 37 million seniors have received at least one preventive service with no out-of-pocket costs in 2013. Another thing the Affordable Care Act does is make Medicare more efficient and reduce their overall health costs. The Affordable Care Act has helped keep Part B premiums from going up. In 2014, the Medicare Part B premium is $104.90, and the Part B annual deductible is $147, the same as in 2013. The 2013 Part B monthly premium, $104.90, was lower than that was previously projected by the Medicare trustees. Because of the legislation's commitment to reduce waste, abuse, and billing errors within Medicare, the trustees reported that the fund is projected to remain solvent until 2029 at least. That's a 12-year extension from previous estimates. Another good thing about the Affordable Care Act that it has resulted in lower-cost prescription drugs and closing the infamous donut hole. Seniors who reach the donut hole will save on average about $1,265 per person. So what is the donut hole? Well, my 92-year-old mother-in-law is in the donut hole. It was a totally unfair gap in coverage that works like this. Under the prescription drug plan, there is a $310 deductible. That's for buying medications. After it's reached, a person pays 25% of drug costs up to the limit of $2,800. After that, the person with high drug costs is on her own until she spends up to an annual yearly total of $4,550. So the gap, the donut hole, was between the $2,800 and the $4,550. $4,550. After that, the beneficiary gets about 95% reimbursement, but many people can't afford drug costs of over $2,800 a year out of pocket. So we're getting rid of that donut hole. Medicare beneficiaries who fall into the donut hole automatically receive a discount on prescription drugs now as a result of the ACA. Each year, beneficiaries pay a reduced cost for brand name and generic drugs in the coverage gap. The law closes the coverage gap completely by 2020. In 2014, Medicare beneficiaries in the donut hole received a 52.5% discount on brand name drugs and a 28% discount on generic drugs. So seniors who reach the donut hole will save on average about $1,265 per person. Nearly 4 million people with Medicare who were in the donut hole in 2010 received a one-time tax-free $250 rebate from Medicare too, and that was to help pay for prescription drug costs that were not covered. All right, another thing the Affordable Care Act does is that there's a $350 million investment to help wipe out fraud, waste, and abuse. The ACA includes some new resources. We've made an investment here. Tools to protect taxpayer dollars by preventing fraud in Medicare and Medicaid's building on the efforts of the Department of Health and Human Services and the Justice Department. The ACA contains a $350 million investment to fight fraud, as well as provisions that will attack those who defraud the system. Over the past 5 years, the government recovered over $19.2 billion from individuals and companies seeking fraudulent payments. There are also tougher penalties for people who steal from Medicare and more law enforcement to identify criminals abusing the law and abusing beneficiaries. All right, now we come to the thing that the ACA doesn't do, and this is a big one. We've listed all the things that are great that Medicare has done to benefit seniors, but now let's talk about what it doesn't do. Prior to the ACA, our federal government, through Medicare, never did provide coverage for long-term care. And that means long-term care either at home or in a nursing home or assisted living. The ACA has not changed that. There was an effort to do so through the Elder Justice Act, but it was defunded in the effort to destroy the Affordable Care Act. The Medicare benefit for nursing home coverage is very limited, and most people don't even get the maximum of the 100 days that it allows paid for by Medicare in a nursing home. Long-term care can literally bankrupt some people, depleting all of their savings. Now in California, you can own a home and be eligible for Medi-Cal, but our laws are tightening on the state's ability to seek reimbursement from the heirs for nursing home coverage. All right, here's something to really understand about the ACA and long-term care and what Medicare doesn't cover, because it certainly doesn't cover everything. By 2020, a married couple will pay between $365,000 to $454,000 for out-of-pocket medical expenses. That's the average married couple with the average needs that people have. So we hope you're not telling your clients that the government will take care of them as they age, or that when they get Medicare they don't have to worry about their medical expenses. Medicare only covers half of it. Now that doesn't even count long-term care costs. That's just to pay for Medigap, that's the supplemental insurance for Medicare, as well as paying the premiums for Part B and Part D, and out-of-pocket drug expenses not covered over their life expectancies. Long-term care is medical and personal care for the chronically ill or disabled, and it can be provided at home or in a nursing home. For the many retirees who are expected to require long-term care, the average duration is estimated to be about 3 years. The average cost for a private room in a nursing home in 2013 in California, one of the most expensive states, was about $125,000 a year. And for 3 years of care, this major expense is expected to rise even higher than that per year. Financial planners, please take into consideration that your clients are probably going to need to pay for long-term care themselves. Just look at dementia, this pervasive issue of dementia. That involves over 5.2 million people in the United States who are diagnosed with Alzheimer's disease. That's the most common form of dementia. That is a progressive brain disease for which there is no cure at this time and no effective treatment to slow the disease down. Everyone who develops the disease will need long-term care eventually if they live long enough, but most people don't plan well enough for long-term care needs. So the government doesn't pay for it. The only exception is for a person who is low income enough and without assets enough to qualify for Medi-Cal, which is called Medicaid in other states. And at this time, that means mostly living in a nursing home. There are a few exceptions, not many. So our summary. The Affordable Care Act has done a lot for expanding coverage for seniors in the form of basic prevention and prescription drug coverage, closing the donut hole, and so forth. This saves lives. The ACA is actually responsible for recovering billions of dollars by preventing and stopping fraud and waste. It has kept Part B, that's the part that covers outpatient care premiums, from rising, and it is closing the infamous and unfair donut hole for millions of seniors who did not have any coverage that they deserve for prescription drugs after they reached that limit. Medicare, remember, only covers about half of all typical medical expenses that a person's going to have in their lifetime from retirement age to the end of life, not including long-term care. The ACA has not done anything for the huge problem of long-term care costs, which affect every financial plan for every aging investor you may meet. And we're hoping here at Aging Investor that you will keep that in mind in your long-range planning for all of your clients, especially as they reach retirement age. If you need more information about this, or you'd like some help with planning senior-specific policies for your older clients who may have cognitive problems, you can contact us toll-free at aginginvestor.com. That's 866-962-4464. This is Carolyn Rosenblatt and my partner, Dr. Nicole Davis, a clinical psychologist, signing up. And as a final note, recall that we can also help your aging clients who are having difficulty in their families or difficulty managing at home, and when they need a strategy and they need advice and direction and questions answered, we're here to help your clients too. Thanks so much. Bye-bye now from aginginvestor.com.